Hi guys, so this is the end of my oral and maxillofacial surgical rotation. This is actually the third and final operating theater day. Today we had two panfacial fractures. I only was able to see the end of one and the beginning of the other. I had some errands to run this morning, so I wasn't able to, stay and view all of the procedures. So I've learned a good bit. It's been a nice little run. What can I say? It's bittersweet because I know I have to go back to school at some point in time. I was working on some things to try to see if I could get the funding, and it's looking as though I might be able to go back this semester, with the added stress of doing exams from last semester, this semester, along with this semester's exams. So I emailed the dean of the school. The dean of the school has said to me that what I have to do is email the campus registrar and get directive from them. So that's that. So in this video, you're also going to see the instruments that we use today. The big one that looks like a clamp is my favorite because that's actually used to cut plates. Panfacial fractures, as well the name suggests, is that pretty much every bone in the face is broken. So the orbital bone was broken, nasal bone. The person had a Lefort type 3 because it was an orbital bone straight through. Then they had mandibular fracture as well too. So the Lefort 3 with a mandibular fracture was what the patient had. Plates and screws is the mainstay of bony fixation, open Dutch internal fixation. So a flap was done intraorally in the mandibular vestibule as well as the maxillary vestibule. An incision was made here and here as well too, to insert plate, which would then be used to fixate the fracture around the orbit as well as up here to fixate up here. And now they're closing. As per usual, these procedures are done under general anesthesia. So pretty much, yeah, it's a major case. So today has been pretty action-packed, and I must say I'm not really happy to be leaving oral and maxillofacial surgical rotation, well, my elective, but you have to sacrifice at some point in time so that you can pursue your dreams. So I don't have to go back to school, and school is pretty stressful in itself. School, going to school and going to work is not necessarily an easy task, but it has to be done. So some interesting things I learned today. For one, I'm trying to learn the actual size of the screws because the screws are so small, but I haven't really mastered that yet. What else did I learn? Earlier this week, actually, we did some interesting cases. We did some third molar extractions where they had to section the tooth in half and extract both teeth, both fragments, because the tooth was measly displaced. It was measly displaced and it was measly impacted, then a horizontal impacted teeth. We had a few of those cases. We had some ameloblastomas again post-operatively. We also had one case of osteosarcoma. Didn't get to see that case, but that's post-op. This patient had a resection of the lesion. So some major cases, some major follow-ups. Didn't get to do any extractions so far for the week, but we'll see how it goes. So keep posted. So this was the setup that was used for the panfacial fractures, as you can see from right to left. There were a lot of elevators. You had pickups. This was from the position of where the nurse was standing. You could see all the arteries that were there. You could see the Selden's retractor here to the far left. The periosteal elevator. You had the Minnesota retractor. You could also see the suction, the dental syringe that was used, the diathermy. You have the claw retractors or the paw retractors further up with the malleable retractor. You have a lot of kidney dishes. You have even forceps used for extraction. So this is just a basic setup here. Hope you guys like.